Hi, my name is Steve Haley. Today I'm going to be doing competency number 2 for sterility. First thing I'm going to do is look at my healthcare provider order. I see that today I have Miss Ren Harumi. Date of birth is March 3rd, 1983. ID number 160011180. She is 6 hours of post-op gastric surgery. She was able to void on her own, but she complains of pain and pressure upon urinating. I obtained an order from a physician to do a straight catheterization to collect a sterile urine specimen for a culture and sensitivity test. My 2 objectives today are going to be to straight cath Ms. Harumi and to document as appropriate. So, first thing I'm going to do is wash my hands, and then I'm going to collect my supplies. Okay. First thing I'm going to get is my MAR. Then I have my basin here for the water for perineal care. Then I have a pair of clean gloves that are intact and unused for the procedure for the perineal care. I have 2 washcloths, one for soap and water and one for water. And then I have a towel for drying. I have a pair of unopened sterile gloves, size 8, non-latex PI. Expiration date is February 27th, 2022. And then I have an unopened Dover open urethral tray with vinyl catheter. It is intact and its expiration date is March 15th, 2023. So now that I have all my supplies, I have my MAR. I'm going to go into Ms. Harumi's room. Put this right here. Knock. She says, "Come in." Come on in. Say, "Hi, Ms. Harumi. My name is Steve Haley. I'm going to be your student nurse today. How are you doing?" She says, "Good." Okay, Ms. Harumi, today I have an order to complete a catheterization for you to collect a urine sample. Is that okay? She says, "Yes." Okay, well, first thing I'm going to do here, I'm going to wash my hands now that I've entered the room. And while I'm doing that, I'm going to get my MAR out. And I just want to ask Ms. Harumi, can you please tell me your full name and date of birth? She says, Ren Harumi, March 3rd, 1983. And on my MAR it says Ren Harumi, March 3rd, 1983. So that's correct. I then go to look at her patient ID band, and it says Ren Harumi, March 3rd, 1983. My MAR says Ren Harumi, March 3rd, 1983. The ID on the band says 160011180. On my MAR it says 160011180. So I know I have the correct patient. Now, Ms. Harumi, can you please tell me what is your, do you know where you are right now? She says the hospital, which is correct. Do you know what day it is today? She says March 31st, which is correct. Today is March 31st. And do you know what time it is? She says 9 a.m., and which is correct because the procedure is being performed today at 0900. Okay, Ms. Harumi, and also I'm going to ask, do you know if you have any allergies to betadine or latex? She says no, so that's great. Okay, so next thing I'm going to do here, I'm going to raise the bed rails. Raise them on both sides. I'm going to raise the bed and then lower the bed rail closest to me. Okay, and I'm going to perform some perineal care here. Before I do that, can I go ahead and assess your abdomen? She says yes. Pull down the sheet here. Going to palpate. Any pain or tenderness? Nope. Any pain or tenderness? Nope. Okay, so she says no for pain or tenderness in both the upper quadrant and the lower quadrant. Now I'm going to percuss. Is that okay? Yes. She says yes. Okay. I percussed. Bowel sounds are dull in all 4 quadrants, and the abdomen, upon inspection, appeared to be slightly distended. However, there was no abnormal bruising or lesions or any other abnormalities which would indicate having to postpone for further assessment. So I'm all set to begin my perineal care. First thing I'm going to do, I'm going to wash my hands. Going to take my basin, fill it up with water. It's filled up with water, take it on back. Going to apply my clean gloves. Okay. Now my gloves are on. I'm going to lift up the sheet here and I'm going to begin perineal care. So I'm going to take this washcloth, wrap it around, dump it in some water, put soap on it. Then I'm going to clean from the farthest side to switch sides, closest side, and then down the middle. So farthest side of the labia, spreading the labia with this hand, switch sides, closest side of the labia, switch hands, switch sides, okay, there we go, down the middle. I'm going to just take this washcloth, I'm going to rinse, soak in water, farthest side down, still keeping the labia spread. Closest side down, still keeping the labia spread. Switch sides, down the middle. Then I'm just going to take this towel and pat dry. Okay, that's done. So I'm going to take this and put it on the floor. And for later, I'm going to wash my hands now that I'm done with perineal care. And I wanted to state this earlier, but upon entering the room and upon palpating the abdomen, doing perineal care, I would have provided for privacy prior to all of this. So next thing I'm going to do, now that I washed my hands after perineal care, I'm going to get my catheter kit as well as the gloves. To open this up. Let's see. Place this out here. Something crooked. Okay. Now I'm going to unfold this, starting here as to not break sterility and contaminate the sheet. There we go. Okay, now I'm going to come around to the other side where there's more space and I'm going to apply my sterile gloves. I'm going to keep an eye on this at all times, of course. I don't want to lose sight of this, otherwise that would be breaking sterility. Note while I'm behind the camera turning it, I'm still keeping my eyes on the sterile field. Okay. So I'm just going to turn this way so I can keep my eye on the sterile field while I'm applying my gloves. Okay. Okay. I'm going to take this, grab the left cuff, insert my right hand. Okay, halfway there. That is the best that has gone today. Okay. Now that's gone. Still keeping my eyes on the sterile field. Now that I have my gloves on, I'm going to keep them above waist level. I'm going to use my elbows to move the camera as to not break sterility. Still keeping my elbows above waist level. Go back around here. Okay, now I'm going to take my drape out of the kit. I'm going to do this over here. Trying to get my find my shiny side here. There it is, okay. So I'm doing it this way. Okay. So take this. Just gonna go here. 2, 3. Okay. Pull this back. Okay. Now I'm going to take my specimen container out of here. And so I don't have to fiddle with this later. I'm gonna put this right here, ready for the catheterization procedure. I'm gonna take my iodine out, my tweezers, my lubricant. Okay, and then what I'm gonna do first, I'm going to put all of my iodine in there. And then I'm going to take lubricant here, put my catheter in after tearing it open. So that's ready now. Throw that here. Okay. Next thing I'm gonna do is I'm gonna take the cotton balls, soak it in iodine. I'm gonna come over here, and now once I place my hand here, I can no longer move it for the sake of because this hand is no longer sterile. I'm gonna go here, wipe down farthest side out, pull it around, drop the cotton ball, take it out, closest side down, and out, around the sterile field, here. Then go down the middle. Still keeping the labia spread, just like with perineal care for all of this. Around the sterile field. Now that I've done that, I'm going to take these last two cotton balls, bring them over here, drop my tweezers. Now all that's left to do is take the catheter kit, I'm going to bring it up closer. Going to take the catheter. I'm going to say, okay, Ms. Harumi, I need you to just take a couple deep breaths for me, okay? She says, okay. I'm going to insert this 2 to 3 inches in, and then once I know I'm in the bladder, I'll insert another 1 to 2 inches. So, ready? 1, 2, 3. Okay. Gonna pinch. Gonna insert into here. Unpinch. I have a return of urine, so I would have inserted the extra 1 to 2 inches. I'm gonna let this drain into here. Finish draining, so I'm gonna pinch it back, put it into here, unpinch, let that finish draining. I'm going to take the cap, place it onto the sterile container. And I'm gonna take this and I'm gonna place it at the stool right by my side here. Now this is finished draining, so I'm gonna say, okay, Mr. Remy, I need you to take deep breaths while I remove this for me. Ready? 1, 2, 3. Good job. Put that right there. Now I'm going to take this, and I'll measure this later. So I'm gonna put this right here by the stool on my side. Now I'm gonna let go. And next thing I'm gonna do, I'm going to take all these supplies I was putting at the foot of my bed as my trash, move them right here, my drape here. Yeah. Okay. Okay. Gonna put that right down here with the rest of my used equipment. Okay. And next thing I'm gonna do, I'm going to wash my hands. And now I would perform perineal care. Say, okay, Ms. Rumi, so next thing we do is perform perineal care, just get you cleaned up. So I would get a basin, I would get 2 washcloths and a towel, just like before. I would use the 1 washcloth with soap and water, clean from the farthest side of the labia, then closest down the middle. I would get another washcloth just for water, farthest side, closest side, down the middle. Then I would get a towel, dab to dry, get rid of all that, and put it back with my used supplies where I have everything at this moment. This would just be for the purpose of getting off any of the extra iodine or lubricant from the catheter insertion. Now that I'm done with that, I will just provide for privacy and cover her up. And then I would wash my hands now that I'm finished performing perineal care another time. And then I'm going to take this, I would measure this, and I would say I measured about 130 ml. Then I would take this and dump this out, and then I would dispose of that and document that after I exit the room. And so what I'm going to do now is I'm going to grab my MAR here, along with my sterile specimen. All right, I'm going to say, all right, well, thank you very much for your time, Ms. Hirumi. Here's your call light. Is there anything else I can do for you? She says no. Great, so I'll be back in a little bit to check on you. So I'm going to exit the room and wash my hands. Stay in frame so you can see me wash my hands here. Okay. So we're just gonna see. Perfect, okay. So I've exited the room and now I'm just documenting. So I'm gonna say I have my sterile specimen here. I'm gonna say the procedure was performed today on March 31st, 2020 at 0900. We did a straight catheter insertion to collect sterile urine specimen. I'm going to say it was 130 ml collected, and that urine clear yellow in color. And then I would put my name and my signature. Okay.